Welcome, everyone, to another episode of the JPN podcast. Thank you so much for listening. Today, I'm joined, as always, by my partner in crime, Mendel Jacobs. And today, we're very happy to announce that we have with us Dr. Rabbi Apfel. Dr. Rabbi Apfel did his medical schooling at SUNY Downstate. He did his residency in pediatrics at the Schneider's Children's Hospital and followed up with a fellowship in cardiology at Columbia Presbyterian, where he currently practices. He later went back to get smicha at the REACH program. You can hear a lot of his shiurim on YU Torah, highly recommend. And his current project is starting Yeshiva Shvilei Chayim. Thank you so much for joining us, Dr. Rabbi Apfel.
Oh, thank you for having me. It's a pleasure. Absolute pleasure.
The pleasure is ours.
And just before we continue, is it Dr. Rabbi, Rabbi Doctor?
How do you prefer to go?
You can call me Howie. That's good too. Convention is Rabbi Doctor, putting, not that doctors aren't very chashuv people, but, whatever. I think the rabbis decided that the Rabbi Doctor, maybe, I don't know.
Okay, good to know. I think
either way is fine, isn't
it? Great. So before we start with the deep hitting questions, we wanted to know a little bit about your history in terms of having to work on Shabbos. Can you tell us a little bit about your residency and your fellowship and what your involvement in the hospital on Shabbos has been, what your experiences have been?
Okay. Well, I was fortunate. I did a Shomer Shabbos residency. And so all the way through medical school and residency, and I remember it came up in medical school a couple of times, if I recall, particularly the surgical rotation, where there was, I won't call it a purposeful attempt, but there was a given that, someone would be on the weekend and no special dispensations. But truthfully, I don't know what the situation is currently, but then it was official that you did, for religious reasons, you could have that on your schedule that you wouldn't work on Shabbos. So, a couple of times I needed to put that into play without any real opposition. Maybe one time there was a surgical attending that looked like he was not going to give a good evaluation on the basis of that request. But other than that, no overt or non-overt pressure during medical school. Then Shabbos residency is interesting, was a fantastic opportunity. It was in those days, not that long ago, but there were more options than I think currently exist in terms of a Shabbos residency, particularly in pediatrics, which is what I had done. It was very limited, and I was fortunate. I went around everywhere I asked for Shabbos, even places that didn't have an official program. And you get varying responses. So it's important for people to hear that, relevant listeners, that it's worth a try, no matter where you're going, because a lot of times it relates to the program just not being aware of it and being amenable to it, as long as it's not overwhelming to them and there's too many people asking for it or things like that. But so I was fortunate that when I applied, so this Long Island Jewish Schneider Children's Hospital, for the first time, decided to try it. And, it worked out very well for me. It did teach me a few things about Hilchos Shabbos, because one of the situations that arises, particularly in the winter, even if you're in a Shabbos program, is a decision that you're, let's say, for example, I remember in particular what happened to me. I was the house doc for a hospital in Long Island, which, in your second year, you get to run the hospital. So it's, it's a little scary, at first when you start doing it. You're going to be the one who goes into the delivery room. You're the one who runs to the emergency room. You do everything there. But it's a very quiet, they wouldn't be having a second year resident do it if it was a busy place. So for the most part, it's like to be truthful, I sat and learned Gemara most of the time when I was at this hospital. One Friday in the winter, when I was zoche to have a person come relieve me before Shabbos, so it was around 4 o'clock, like that kind of area. As I'm walking out of the emergency room, I see this family walk in with holding their daughter. She looked like something major was going on. It turned out she had anaphylaxis. That was actually the reality, and I had a decision to make. That's going to be very relevant to maybe some of the questions we're going to discuss later. Do I leave with the and take advantage of the fact that I'm on the Shabbos program? Officially, I could leave and leave the poor person who's taking over for me to deal with something that's very difficult to do on your own. No one likes to do those kind of things on your own when there's lo aleinu, an imminent arrest or something like that. It's never a comfortable thing on your own, but I could have. Or do I stay, right? Do the right thing, stay, help them out, but possibly be caught there for Shabbos. Now, we'll learn what the halacha is in a little while. I'm better versed in it now than I was then. But I decided, whatever will be, you have to do the right thing. So that was the first time I actually worked on Shabbos, was I stayed. And, Baruch Hashem, she did well. The girl, the person who had come in for me, really appreciated it. I thought it was very important anyway, in terms of the Shabbos program as a whole, that they saw that would be the way we would behave, make a Kiddush Hashem as opposed to a Chilul Hashem. And that went well, but I was there for Shabbos. In the end of the day, I was able to get to my brother, lived not too far away, so that worked out for me anyway. But as we'll learn later, the halacha is that under those kind of conditions, I could certainly take a taxi home. I could have done that. There are very significant shittas that said I could have even driven home, but we'll talk about who says what and what we should follow later. But short of that, I never really had to work on Shabbos during residency. But comes fellowship, and this itself became an issue. I wanted to be a pediatric cardiologist. I didn't want to be a general pediatrician. I wanted cardiology. So that was my passion and my desire. There was no such thing even close to a Shomer Shabbos cardiology fellowship, let alone in a quality place. And so I asked the Shiloh, I said, can I follow my passion on this, or do I have to give it up? And for me, fortunately, got the answer that I could do it. But the caveat, of course, is, and this is going to be something that colors every discussion about Hilchos Shabbos and Refuah, is, of course, you cannot be Machal Shabbos Keneged Halacha. In other words, you're allowed to put yourself in this position. That was the Chiddush. I could have put myself into a position where I'll be dealing with Shabbos issues as opposed to avoiding it, but with the caveat that I could never do it wrong. I can never, let's say, do something that breaks the rules of Shabbos. So I then went on to my fellowship, and I was able, with that Heter, I was able to go to a quality place, like Columbia is a very excellent pediatric cardiology place. And I was on my first year 9 Shabbosos, my second year 5 Shabbosos. So it was a very finite number, which is going to be relevant also halachically speaking, because, as we go through the what's mutter, what's not, no matter what is mutter and what's usser, the hierarchy always needs to be sort of taken into account, meaning you always try to do the least objectionable degree of Chilul Shabbos if you're going to be involved. So at that time, my fellowship had call from home, for example. You could do the whole call at home and just come in as needed. So needed meant you have to round in the ICU the next day for sure on Shabbos, but you didn't necessarily have to come in once Shabbos started for the whole Friday night. So the big shiloh was, what do I do? Do I go home, knowing I have to come in the next day for rounds? And I personally elected at that time, and this also is part of a halachic shiloh that I think we're going to deal with later. I decided it's a finite number. I can manage this. I stayed in. So for all my calls throughout my fellowship, I spent them in the hospital. Now, patients loved it. The nurses loved it. The attendings loved it because, I was there. And it became a very, very useful thing for them. My wife didn't love it so much, and I had 6 kids already, I think, at that time. Wow. So, but compared to what some people have to do, which is be on every third or every other, I didn't think it was such a major sacrifice, especially, it was finite, 9, 5, 0. And that was my first exposure to really being on. And once the person gave the heter, told me, you have to do it kehalacha, it really inspired me to learn Hilchos Shabbos in general very well, and especially as nogea to the goings on in the hospital. So that's when I started really getting into it. Ultimately, for the rest of my life, I've had to deal with it. It's very hard to be a cardiologist unless you can get a practice where they give you off on Shabbos. It's not a very common thing to really let out the truth. So I've had to deal with it since then in a different setting. I don't have to be necessarily in, but I could take call from home. And that has its own sort of shilas that go along with that. So, that's been the scope of dealing with Shabbos. So it's something that it's a great impetus for learning the halachos properly, because the better you know it, actually, the less machmir you have to be, and the more capable you are of doing things benachat, which is very important when you're taking care of patients and you're taking care of potentially ill people, and making decisions where rationalization is lurking behind every corner. You'll see what I mean by that very soon when we discuss, when you're on call from home and you have to decide whether you're going to go in, you really want to take Shabbos out of that equation. It should not be a factor in making your decision. It is certainly not proper medicine. It's not the way to take care of people. So we'll have to see what type of leeway there is with that. But the better you know the halachos, the more equipped you are to sort of facilitate that.
Yeah, I mean, that is really the perfect. Oh, my visual just cut out. Are you guys still able to see me?
Yes.
Yeah, we're still here.
All right. So, you know what, Menachem, why don't you take the next one while I try to figure out how to fix the visual on my computer right now?
Yeah, of course. So you kind of alluded to it a couple times, but I figured just to take any ambiguity out of the conversation, you mentioned that you were able to get a Shabbos insured program, and then later you took a program that was that tried to be accommodating but not completely. And you mentioned that Rabbi Willig gave some sort of heter. Can you explain how that model and that heter, the halachic model, kind of works to allow that dispensation?
You're referring to the fellowship, meaning being able
the
to
fellowship, yeah.
Right. So, okay, I hadn't actually mentioned the posek, and you did. I did it before. The reason I'm saying this is I want to just emphasize this is a psak I did get from him, and I don't think you can necessarily generalize or broaden out the psak I got. It's every situation is different, and the shaila needs to be asked. That's my point. But now to get into the psak, because I've been asked this shaila now, and I've been in this position now from the other end. The way it works is like this. There are two schools of thought on this. There is what I'll call the Rav Shechter approach, which I'll just give it a label for obvious reasons, because it's how he feels. And in the discussion of the issue, it's really a machlokes, I'll tell you the truth, to some degree, between Rav Moshe Feinstein / Rav Shechter and Rav Shlomo Zalman and Rav Willig. Okay, I'll put them over there, but I don't think it's fair of me. I can't account for their full scope of their shita. But what's it about? What is the basic fundamental difference of opinion? It's really like this. There's a famous, very, very complicated issue of when we say pikuach nefesh is doche isurim on Shabbos. Is it working hutra or dechuya? Right. That's the terminology. What do those terms mean? Normally, what they mean is if something is mutter under certain conditions and it's dechuya, it's sort of like if push comes to shove and you have no other choice and you can't avoid it, so it's still usher, but you could do it. It's nidche, the isser is nidche. But realize when you do the act, you're doing an isser beheter. You're doing an isser, but with permission. As opposed to hutra, which means, no, the isser's off the books, it's mutter. It's mutter under these conditions. So that's a famous shaila. Which one is pikuach nefesh? Is pikuach nefesh just make it mutter, or is pikuach nefesh dechuya? So the overwhelming majority of Rishonim, Achronim, the Shulchan Aruch hold that it's dechuya. That it surely is dechuya. Now the question is, what does that mean? So What it normally means in other areas of halacha is that you can't put yourself in a position. You got to avoid it. You have to like do whatever you can not to be using the dispensation. So is medicine is pure nefesh working that way over here? The answer, so is the Chuli Alma, no. Everybody realizes there's something special about the Chai Bahem and Hatzalah. It's its own realm where even if it's the Chuya, you're still always going to be able to do it. That's why the Rambam in across two halachos. In one halacha he says the Chuya he pikuach nefesh etzel Shabbos. Two halachos later, or one halacha later, he says, but it's to don't do it by a nochri, don't do it by a katan, do it the Yisrael Gadol himself, right? Which is almost paradoxical. How could that be? If it's the Chuya, I should be trying to get Amir Lanachri in here. I should be trying to avoid it. And yet he doesn't. So the reason is because it's Hatzalah and it's a big mitzvah, and we do everything we can for it. So then what's the point of calling it the Chuya? That becomes the issue. So if there's no real halachic nafkamina, or is there? So Rav Moshe Feinstein says there is. What is it? Not mitzad the chola. The chola can have anything done to save him, but the rofe has to try everything to avoid being in that position. And he introduced this idea that he is in a famous tshuva that you don't have your phone number listed, avoid anyone contacting you. If you're on call, stay in the hospital. Absolutely don't go home because you know you're coming in. And forget about a shift. He writes, even if it's just a possibility that you'll be called in, you should stay in the hospital. And that approach maintains that that's what the Chuya means. Rosh Zalman didn't agree with it. Rosh Zalman, in a very famous tshuva, also writes otherwise. He says that you don't have to take proactive steps to avoid being in a position where you're going to use pikuach nefesh to be doch yisur. So, for example, it comes out with a pregnant woman, says Rosh Zalman, what, she has to move over to the hospital in her 9th month to avoid the possibility that she'll have to come in? Of course not, he says. Obviously it's a midas chasidus. It's a very meritorious act to try to minimize and do things like that. But there is no obligation. And he says for a doctor as well, you're not obligated to do that. And you could, allow yourself to be called in for the issue. Now, there's various levels of this and how far you take it. So those who take it, like Reb Shachter, like Reb Moshe Feinstein, and some others, insist on it as being one of the reasons you have to do Shomer Shabbos residency or not. I remember I had a personal conversation with Reb Shachter about this, and I said, really, you should not become a doctor because, ultimately most doctors are going to have to do this. So, he was kind of joking, but he said, yeah, he said, come to the kollel, like he told me, come to my kollel, I got a spot for you. And it's very funny, this particular story, Rav Shai Shechter, I don't know if you've heard him, he's very well known now, big Maggid Shir, really wonderful person, unbelievable, but he was about 3-4 years old when I had this conversation. He walks into the room as I'm talking to Rav Shechter with a little doctor kit. I thought it was too funny and that he set it up. But at the end of the day, there are those two very different schools of thought on this general approach to things. And it results in all these nafkaminas related to what we're talking about, including, are you allowed to take a residency or fellowship that will not be Shomer Shabbos, where you'll have to work on Shabbos? So if you hold the avoidance approach that you have to avoid at all costs, then it makes it very limiting. But if you go the Rav Shlomo Zalman route, it opens up the possibility. But of course, the caveat is that you can never ever do the Chilul Shabbos that's not within the guidelines. So it's got to be real pikuach nefesh if you're going to do a doraisa. It's got to be a chol she'ein bo sakana if it's a derabanan. And there's various rules that we can go over, whatever. But that's a very important caveat. It's a mistake some people make. I remember they used to quote Rav Tendler all the time. He wrote in his Sefer, he wrote a sort of a quick check kind of what to do on Shabbos kind of book. And in it, he quotes Rav Moshe Feinstein, actually, which is interesting because even Rav Moshe Feinstein sees room for a person to become a doctor. So that shows that I never really thought Rav Shechter meant ad kidei kach, that you shouldn't become a doctor at all, because then you're leaving out the Rambam, the Ramban, the Rashba. They were all doctors, and many other Gedolei Yisrael have been doctors. So it must mean something a little more tempered than that. So he writes in the book that when he asked Rav Moshe Feinstein, he said you should take the best quality place, best quality residency. That's what you should do. So everyone saw this as a blanket, heter now. Oh, we can just do whatever we want. But what they don't read is the next line in that book. He writes, of course, you can't be Machal Shabbos inappropriately. And that's the trick. Now, I would say I did a Shabbos residency because I still feel if you're able to get Shabbos, it's still the best option for many, many reasons. The first one being is we're still, even though we have a heter here, we're still obligated to try and lessen in any degree, we're supposed to lessen the degree of being over on any chilul Shabbos whatsoever. So it is always still the best first choice if it's available to you. What was a chiddush to me in that psak that I got then was I could have done other things. It was my passion to go into this. Is my passion really enough to justify doing it? And if you're in the school of thought of Rav Shlomo Zalman, and apparently Rav Willig, and I'll say that, he let me do it, then yes, you can make that decision.
Before we continue the conversation, for anyone listening that hasn't heard our previous work, I'm just going to sort of not self-promote, but it is important that Mendel did put a number of lectures out discussing a lot of these basics of how Rosh Zalman's heter works, and we have a recording with Rabbi Willig where he highlighted a lot of these points that we just discussed. So if at any point anyone watching this is not entirely sure what we're referring to, please by all means check out those videos. We went in depth about Rosh Zalman's approach. We discussed Rav Shechter, and we had this personal discussion with Rabbi Willig, which highlighted a lot of this.
And if Mark doesn't want to, want to push too far, I will shamelessly plug. Watch our previous stuff on Spotify and YouTube.
Yes, we make a great team. So following the conversation going forward, I think it would be really great to discuss some of the nitty gritty about, you got your heter to take a non-shabbos fellowship, but that comes with a lot of complexities. So I think just starting that conversation right off the bat, pretending that right now you're on call, it's your first time that you on call on Shabbos, and you have to carry your phone and or pager for when that call comes in. There are questions that come up. I think first off, it's kind of uncomfortable at first to kind of keep those things on your persons that when you're not really supposed to do that. But I guess the real question is in terms of carrying it on you, and even more so, actually, like the malacha of carrying. Can you tell us a little bit about having your phone and or pager on you, and if there's some sort of shinoi we should be aware of, and to do that in the best possible way?
All right, that's a very good question. I'll start with this. The fact that you feel uncomfortable is a good thing and should continue. No one should work to become cavalier or used to it. It's a very, very important protective measure. I'll tell you what else I used to do. To increase my discomfort, maybe, was normally when you're on call, you wear scrubs. Now, from one perspective, let's say you're traveling in, to minimize the marasayin, it's good to wear scrubs. But on the other hand, to make sure that while you're in the hospital, you're conscious of Shabbos and you're thinking that this is not any other day, it's important to dress for Shabbos. So I used to do that. Now, because I was staying in the hospital, I didn't have to do the scrubs marasayin thing, right? You know what I meant? What I mean by that is that when you're taking a taxi in or driving in, if you're going in scrubs, so everyone, okay, he's going in for some medical emergency, the thought process will not be to think the negative things that create Maras Hayim. But if you're in the hospital anyway, if you're staying there, so obviously you don't have the issue of carrying outside in Hutzah, but it's certainly muksa, and perhaps it's not muksa because you're on call and you're going to need it. I'll say this, nowadays very few people use pagers or beepers. It's really becoming obsolete. Most people, including myself, have switched over to everything's in the phone, and it has certain advantages for Shabbos. I could see now what's coming without touching anything, and know what's really an emergency and what's like, oh, I want to make an appointment next week or whatever. That's certainly not something you should be Machal Shabbos over. So that's a very big advantage of it. It also is sort of facilitates the communication back, hopefully with just one push instead of more. You have to come up with a shinoi if possible. And, again, a shinoi in using a phone is tricky. It's not going to just be right hand, left hand. That won't count for holding your phone. But trying to use something that has the heat or whatever, the sensor that operates phones, that allows you to do it. So, a knuckle would probably be somewhat of it. But if you find, I've had this issue with people, they end up making mistakes, when they're trying to hit something, they hit the wrong thing. If the shinoi causes more chilul Shabbos, don't use it. That's what I'm getting at. Sometimes that's the reality. There's no way to, if you're on call, there's no way to avoid having your phone. But so you're gonna have to have it with you. The one thing though that you don't have to do is, and if you're good at this, is you don't, let's say you're at home, you are in a call from home situation, or you're in a call room or something like that. You don't have to be holding it all the time. It's good practice to get into this, put it down, I'll take it when I need it. If I'm leaving this room, I'm gonna take the phone because you have no choice. You have to be accessible. But while I'm, know that I'm stationary, I'm gonna be sleeping in a room or doing something like that, then you don't need to bring it around. The other sort of challenging thing, and I learned this the hard way. In the beginning, when I was on call, actually as a fellow, and then we did have pagers, we had beepers. So, there's a catch-22 here. You want to be not disturbing people with your beeper going off, certainly if you're going to be in shul or something like that, so you have it on vibrate. But if you don't have a mechanism to wake you up, if you fall asleep, like in the middle of the night, you end up in big trouble. Like, so fortunately I was sleeping in the hospital because I stayed in, but my pager had been on like vibrate, and I don't know why, because I wasn't going to shul. So I don't know how it ended up that way. And I had like 5 people banging down the door trying to find me because it didn't wake me up, the pager. So this would be something you have to, it's a pragmatic little pearl. You have to make sure that you're set up in a way, you don't want to disturb people if you are in shul or something like that. Then what I used to do when I became an attending, and we still had beepers, but we had phones. So I used to use both. I would use my beeper by my bedside so that it would wake me up, and the phone on vibrate so that I could go to shul and not bother anybody. There's no getting used to it, and or I should say it this way: you can get used to it, but again, like I said at the beginning, that's not a good thing. You don't want to get ever used to being Machal Shabbos. It's always got to be looked at as Bakoshi, I'm doing this, I'm not comfortable doing this, but I need to save people and I need to do it. And really, it's not a shiloh that you're going to need to carry the phone and have it with you. That's really beyond any question. If you, let's say, coming inside the hospital, so a lot of people will carry it in their sock as a shinoi, which is a very valid shinoi. I heard on Shark Tank, so when I was telling somebody about this, they told me that there was some from person on Shark Tank that developed this little pocket for the sock for that. I don't think they advertised it as to do it b'shinoi, but I was thinking it could be counterproductive. Like if they really make this thing, it becomes normal, and then that whole shinoi is out the window. But for now, it doesn't exist as far as I know. commercially available to everybody. So it would be probably the most reasonable shinoi to get into the hospital with it. And it's helpful in terms of a little bit of muksa and in terms of hotzah, in terms of that.
Interesting. I'm just thinking, as you're explaining everything, it seems like some good things to keep in mind would be even to unlock your phone, to make sure that you have as little barrier in terms of whether it be a code you put in or whether it be a face unlock, to probably disable all those things, and probably limit whatever can send you notifications on Shabbos to stop you from having to look at it every 2 seconds.
Yes, absolutely. And there's a lot of input you could have into that. Even with private services that people end up using when they're attendants, you can tailor make it, and it's very, very important to do that. The other thing you just brought up or reminded me of, another very important thing to do, is get as many of the common numbers you need, services that you need to call, consults you need to call, on one touch dial. Like that itself is a very much a good proactive move that you can make to minimize the amount of field shops that you will do. If you could just get it on one, it helps a lot.
Okay. All right. So now going chronologically. So I think we got a lot of good halachic pearls and some clinical pearls as well, in regard to how to use your pager or phone, and how to potentially be available to accept call. Let's say you're called to the hospital. What's the halachic guidance for traveling to the hospital?
All right.
Sorry, if I can just interrupt, just because I want to we try to set the tone for the conversation. Everything we're discussing is under the concept that every time you go to the hospital, you're going for a patient who's cholish yeshbo sakana. Are we under that pretense?
Oh, well, I was about to preface my response.
Okay.
You never really know till you get there, right? You never really know. Especially if you're the doctor that's making the assessment, then for sure. Well, let me step back. In real life, how does it work? So in a field like mine, it's 99.9% of the time suffix sakanas nefashos, right? Cardiology. If you're getting called from the hospital, it's going to be anyone who's admitted to the hospital for a cardiac problem is for the most part, going to be a suffix sakanas nefashos. That's a little bit of an advantage to some degree in this field. There are other fields where that's not the case, and that you're right. It's a different. I almost have to answer this question in each context. So I'm going to start with the easy one. So in this context, if it's an absolute emergency, which sometimes it is, blue baby, someone's on the verge of cardiac tamponade, or they're getting hypotensive, all those kind of things. You just get in your car and you get in as soon as possible. In no way can Shabbos ever, I can't emphasize this enough. I'm a very big advocate for absolutely be machmir on sakanas nefashos, which means you take zero chances on these things. You really have to be certain that whenever you're going to take a liberty in terms of not rushing in, right? And let's say go by taxi, which we'll talk about in a minute, that you're positive, you're not in any way endangering the person that you're being called in for. So that's step number one. Now you do learn, and you could be very effective as this. You don't always have to assume it's the worst. You know the kind of things you get called in for. And I won't go into the medical details, but there are many scenarios where I know it's sakanas nefashos immediate. It's called bahol. I'm gonna go in my car. There's other scenarios where it's got a few hour leeway, and I will go in with a miral and achri. Now, miral and achri comes in varieties, right? And this is always a shaila people have. Does that mean public transportation? Does that mean taxi, Uber? So I'll tell you what I think is the least objectionable. And this really is something everybody should ask their posek to work out with them. I've been through several permutations. I remember the thing that I thought I was doing best with, Halachic, was I had prearranged, it was pre-Uber. There was no such thing as Uber. So I had this Turkish taxi cab company, not Jewish, which is absolute must, right? I can tell you many stories about people have told me, they got in their Amiral and Achri, and then the guy starts bragging about how Jewish they are, the taxi cab driver. So that's a disaster, to be honest with you. That's not a kind of scenario you want to be in. Of course, you're going to go in, but you never want another Jew, observant or not, doing malacha for you. That's like a big no. So what I did was I was very, you get much more comfortable with this. And in the New York area, it's particularly easy to talk about the issue. Although outside the New York area, it might be easier to get people to comply, but that's a whole nother discussion. They seem to be less tense about Orthodox practice outside of the New York area. But anyway, here I arranged with this Turkish taxi cab that I would need to come in on at times on Shabbos. I want to have a system where I minimally get in contact with them. They know exactly who I am, what I'm about, come over, open the door. I don't have to do any malacha. They don't think I'm crazy. I mean, before I did this, I had a taxi cab driver. I thought he was going to have an MI in my house because I go out to him and I'm trying to explain to him this idea that I need him to come in, go to my wallet, take out the money, and he's like shaking and he's like thinking I'm like going to kidnap him. I don't know what he was thinking, but if you prearrange it, people are understanding and more, especially you give them business, they're more than happy to accommodate you. And so the only time I had it better than that is I had a fellow when I was a second year attending. So there was a cardiology fellow who was from Saudi Arabia, actually, part of the princely family. He comes over to me one day and he says, you're not allowed to like drive and do things on your Shabbos, right? Or Sabbath, whatever he said. I want to be your Shabbos guy. And it was like, I couldn't believe it. And he volunteered and I had him throughout his fellowship. Of course, he got a lot of teaching and he got a lot of extra stuff, but it was remarkable. So like, he just like followed me around and he was always at the ready. I just had to call him. He came in, he did everything. So that's the best travel arrangement if you have the time. Nowadays, taxi cabs are not so ubiquitous anymore. It's more Uber, and Uber is not bad either. Now, Uber you can arrange. Let's say you're going in for a shift or something like that, and I should explain under what circumstances that could be, because technically, according to Rabbi Moshe Feinstein, you should be in, but there still are circumstances like Rosh Hashanah, like we said. But under those circumstances of Uber in, Uber out, to quote a posek I once spoke to, and whatever you can arrange even, so to totally minimize. If you know the timing, you should definitely arrange it ahead of time. That's doable on Uber. Sometimes it's not like that because you just get called. You don't know that you're going to come in, and then you have to use the Uber thing. But you're not dealing with money. You're not, a lot of the other problems are taken care of, and hopefully you won't get a Jewish driver. Again, the vast majority are not. So that would be next. Public transportation is an option, but you're carrying the metro. There's not a lot of difference between public transportation and Uber halachically. You could start to tease through the details and you see they kind of even out a little. Each has pluses and minuses. So like public transportation, the metro card is unavoidable. That's muksa and you have to use it as opposed to Uber where you don't. Both of them, you're going to be carrying your phone anyway. You're going to need a phone under most circumstances. I can't think of too many where you get away with leaving a phone at home. So you're taking that anyway. There's Maris Ayin in both. So you wear scrubs, right? People are looking at you. But I always favor Uber anyway, because often the subways are dangerous. If it's depending on where the hospital is and the neighborhood and the conditions. Like I will have women call me with this shiloh. And for them, for sure, I say, you're coming back late Friday night, from Jacobi Hospital in Einstein, and you're walking. I just had this exact shiloh. That's why I'm using these details. They're asking me, what should I do? I could have a 10-minute walk to a subway, in the Bronx somewhere, and to take it home to New York City, or I've been Ubering, what should I do? So, I went through the halachic analysis with them and I said, I think it's a wash in terms of the number of derabbanans in each, but for safety reasons, I recommend you do the Uber. And especially if you have an idea of timing, arrange it ahead of time, you can even minimize more. So those would be the considerations. So the hierarchy is Again, if it's a real mamish emergency that you need to be there right away, don't even think about it. Don't even think for a second about it. Drive in. We'll talk about leaving and coming back home, what you do next, but drive right in. If it's not Bahol, then the best next thing is to have a taxi arrangement, if you can, where the person knows and you don't have to pay, you don't have to do anything on Shabbos. Uber and public transportation. Keseder has that order.
All right. Honestly, thank you so much for clarifying. We spoke about how maybe you would have to arrange something before. Thanks for covering all of that. So we've established that you can call the Uber. Obviously, if you can do it before, that'd be better. If not, you'd use a Shvilei to punch the details into your phone. Now you mentioned that of course you're gonna have to take your phone on you. And so I had a couple of questions in that regard, and they all center around this idea that you're not allowed to carry on Shabbos. Deraisa, biblically, you're not allowed to carry from Reshus HaRabim to Reshus HaYachid or Reshus HaRabim, right? It's about changing that legal status of the area. Is the Uber or Reshus HaYachid, or can we make any of those distinctions? You mentioned that you asked the taxi driver to come into your house to pick up the stuff. How do you take your stuff? Should it all be in a jump bag together? I know it's like a whole jumble of questions, but
right? No, they're all related. It's very good. No, when it comes to carrying things, there's three issues going on simultaneously. There's Hotza, the malacha of Reshus HaRabim to Reshus HaYachid, and that consideration. There is Muksa, being metaltel Muksa, moving something that's Muksa, which is a independent consideration. And then there's Tchum. Tchum is another one. The Halachic boundaries that have nothing to do with carrying. It's its own area of prohibition, where you only have from the place where you're residing, you only have a very finite amount of distance that you're allowed to walk outside those parameters. Not only you, but your possessions have the same limits. Now, for the most part, in any metropolitan area, that last one is not a problem because the area expands to the edges of wherever the city is. And in most situations, you're going to be covered by that. Not always. I was living in New Jersey and I had to go to Columbia, over the bridge that's outside the Tchum. I had to ask a separate shaila on this because it made things very complicated. There is a certain distance that's even an Isser Daraisa, a biblical prohibition, and the stakes started getting high. As it turns out, and again, this is a case-by-case sort of shaila question to ask somebody, and the person I asked, they're squaring off the areas of the various neighborhoods that facilitated this issue. Not every scenario, particularly, you guys must have a widespread audience, like all over the United States, I imagine. So there will be areas that are clearly, involve this third issue. And sometimes it complicates things very, very significantly. But again, anything you need for the safety of the patient, you're going to be able to carry no matter what of these three prohibitions are in your way. But again, we want to do it the least objectionable way. So we're going to do whatever we can to avoid carrying in the normal way. So you'll take, first of all, the minimum that you need, but everything you absolutely do need. And that will be things that not necessarily are patient care related, but just allowing you to be active and able to do things. So if you need a key or something to a certain room where the echo machine is, or you need to have a key card to get places, which is another one of the questions that you had on the list, is all the things that are going to be necessary to do to take care of the patients you're going to need to do. Again, at each step, there's a hierarchy way of minimizing what you're doing. So like, for example, depending on the rep, how fast you need to get in. So you get to the hospital, you get those electric doors right away. So the first thing is, if I could give it a few seconds or a minute, I'll wait for someone to get in ahead of me and I'll just follow them in. And you get good at this, when you're, sort of educate yourself and then get used to it and get into the habit of, even during the weekday, sometimes you get so used to it. During the weekday, I wait for someone to come in, what's going on. It's not Shabbos. You can just walk right in. But it's not, I'm happy that I get that way because it keeps me on my hierarchy all the time. So in terms of the initial question, so you'll carry with you, and again, the bag itself, right? If it has things that are not muksa, right? That facilitates carrying the things that are muksa and eliminates that problem altogether. You make the bag, it's called a basis l'davar ha'aser and a davar ha'muter. And I always say a good sefer is as valuable as any cell phone or computer or whatever. But that's not a total joke. That's actually, has some halachic validity. But there's ways of getting non-muksa things that are very valuable in there, and that covers that. In terms of like the prohibition of carrying the malacha, the hotzah, so there, to some degree, we're relying on a leniency that bisman hazeh, there's no such thing as a Reshus HaRabim daraisa, and that's very helpful. And I wouldn't do it without bigger shoulders than mine to paskin this way, and that is a legitimate psak that is part of the cheshbon here that allows you to think of this as not a severe biblical prohibition, and it brings it down. And it's just important at every step of the way to be thinking that way. Once you get in, again, you want to, from the Reshus HaRabim, which is now we're calling a Carmelist or non-real biblical Reshus HaRabim, so you'll still want to not carry from there into the hospital. That's where the major challenge is, right? From your house to the street, and then from your street to the hospital. That's where the big crossovers are. So you really want to be doing as much of a shinoi as possible for those. And again, shoes are good under your yarmulke. Those are all legitimate. Right, left is not going to work. The only thing right, left works with really is writing, is writing where it's a biggie. But short of that, most of us are ambidextrous with most of these other activities, so it's not going to count as a shino. But the other, cleverly, using other means of carrying, things that are awkward and whatever the item is, I could describe what things that people do.
So just to elaborate for those that might be listening to it, you kind of like motioned that you can potentially hold a bag under your arm.
Right. So that you got to be careful with that one. It's interesting. The Gemara itself, it's Mishnah.
It uses,
It mentions like every part of your body, like as normal carrying, right? So, but there are certain items you do that way, and there's certain items that you don't. So, like under your chin is Mechuli Alma going to be a shinoi in carrying something, right? And the sock thing and the shoe thing, that's definitely one. Pockets obviously are not a good shinoi. Right, left is not a good shinoi. And I think it's a little misleading. I did under my arm. It's got to be something that's really a shinoi there, but because a lot of things do get carried under the arm like this.
Can you hold it on your forearms? Like you're testing.
Right. So with the back, like with the back of your hand, like something that's obviously not a normal way to carry, like my stethoscope, the stethoscope around your neck is about as normal for a doctor as, like putting on his socks. So that's going to be a terrible shinoi. But, sometimes if you have like an otoscope or an ophthalmoscope or something like that, and you do it on the back of your hand, that would certainly be a shinoi, but you also might break your instrument. So you got to be very careful. Sometimes, you really undermine yourself in what you need to have there. So you have to be careful. I can't think of a very good shinoi for something as large as that. So sometimes you have no choice, but you need it. As long as it's for somebody who needs it, then you'll bring it in. Now, hotzah daraisa, we would need it to be pikuach nefesh. If it's hotzah derabanan, especially with the shinoi, then that could even be for chol she'ein bo sakana. Doesn't have to be pikuach nefesh. And that's a very important thing. I would say somebody who's interested, as hopefully many people are, in really preparing themselves for practicing medicine and being on call on Shabbos and being on Shabbos, the first thing to start with is the categorizations of the different cholim. I assume you guys have done like a sort of a segment on that where someone goes over all the categories and what type of heterim are available under each one, and that should be like second nature to everybody to know that, and that's always in the background of all these kind of maneuvers and decisions.
Shameless plug, video 3, where we go through the Ramban, Rashba, and everybody else.
Great, excellent.
I would love to just back up just a little bit so we can kind of clarify exactly what we're talking about. So in terms of getting that initial call, you got to come into the hospital. So, Mendel and I we've never received that call, but presumably you get a little bit of what's going on with the patient. And you can kind of make a quick decision whether or not that's a patient who is sheish bo sakana or she'ein bo sakana. Is that fair enough?
Yeah, so the triage is right then and there, the initial triage, which means, typically, if let's say, depending on your position, right? So if you're a resident, so you're going to be in the hospital, but you might get a call from a nursing station, right? It's going to be obvious to you, and anyone who's working as house staff. The nurse says, the patient can't breathe, the patient can't do this. Those are all immediate sakanas tefashos. There's like not even a question, right? The real emphasis I want to make is, and if you have a suffix, it doesn't change a thing. Just go. You need to be certain it's not sakana. That should be the posture, and I can't emphasize that enough. This is in the school of thought of Rav Shlomo Zalman. There are, like, the Tzitz Eliezer has a kind of different posture on this. I'll do it this way. Actually, this is a very, very important, to me, one of the most important yesodos, fundamental concepts in this area of halacha, is there are many situations that are what we call alul lehistaken or suffix sakana. They're not a sakana right now necessarily, but they could be, and we're not sure. And how do I decide? What do I do? So the Tzitz Eliezer of Waldenberg and others, the Binyan Sion, it's Rav Etlinger, there's a whole school of thought like this. Well, if it's not a chola lefanenu, if there's not mamish, a sick individual there who's a sakana, go with a rove, which is an incredible chumrah to me, and not a good one. And it means in the medical world, it would never hold up, to say, your threshold for considering danger to life to be 50% or more, that's, like, to me, crazy. So I much prefer the approach of this time Rav Shechter and Rav Shlomo Zalman. They have a much, I think, practically speaking and patient safety speaking, better approach to these type of situations. What they'll say like this: how would you react to this case, situation, etc. on Tuesday? Would you feel a certain sense of urgency, right? For example, I'll give you a classic example. I get visits to my home all the time, potential otitis media, right? Potential strep throat. These are like minor kind of pediatric things. How would we react on Tuesday? Would we rush them in? Maybe, right? Whatever we would do for the particular scenario, that's going to be our guiding light on Shabbos. So that, I love to give this example. I get, in cardiology, there's a complication, postoperative complication called, we said it before, a tamponade or post-pericardiotomy syndrome, where there's a pericardial effusion that develops. And, depending on how much it is, it's either an emergency that you got to rush in for right away. It could wait, So how do you know? So the typical thing is the attending at home gets a call from the fellow. The fellow, has some experience in echocardiogram, so they have a say. So if it's July, and you guys know what I mean by this, if it's July, where they just started, so I don't care what they say, I'm going in. If it's June, then I have a lot of confidence in them. They've done it for a whole year. They know what they're doing. I'll listen to them, and I really will take them seriously. The big question always for me was, what about January, right? Like, which way am I going to go? So I say, well, what would I do on Tuesday? You know what I would do on Tuesday? I'd go in. If on Tuesday I'd go in, on Shabbos I'm going in. And that type of litmus test how will I react, right? Some people used to ask me, Mishum sakanas nefashos, because of pikuach nefesh, I think I should be able to read my medicine on Shabbos. Now, whether or not you're allowed to read medicine on Shabbos is this an independent. Let's say you're going like the Machmirim, who say you're not allowed to. So they want to know, but Mishum pikuach nefesh. So I say, so when you read your medical textbook on Tuesday, you feel like you're solving pikuach nefesh problem? I said, no. It came out in a big shiloh, a big machlokas between Rosh Zalman and the Tzitz Eliezer about turning the car off. Let's say you rush in, right? So that's the kanas nefashos. But now, do I turn the car off? So somebody had told Rosh Zalman, well, if you don't, it's going to explode. So right away, on the basis of that information, he said, well, on Tuesday, I would be turning my car off. I'd be very worried about this. I would consider this an emergency. So he said, mutter. And the Tzitzilas are screaming, what are you talking about? Your mechanics don't know what they're talking about. My mechanics told me you're going to just run out of gas. And he was right. Probably that is what would happen. So that's where he presents, you need rove. If rove at the time, it'll explode, right? Rosh Hashanah says, we're not going to use rove. We're going to use Tuesday. We're going to use, what would our reaction be, not on Shabbos and that? And Rosh Hashanah says the same thing. It's kevan dedashu be'rabim shomer p'sayim Hashem. Whatever you're allowed, there's a prohibition of putting yourself into a sakana. So that's where this question comes up as well. Well, what am I allowed to ski? Am I allowed to smoke? Am I allowed to skydive? So do you consider those activities societally dangerous? Do you just, or not, will determine this halacha. Do we consider it a sakana that it's asr? So it just happens to be, I don't want to kill anybody who likes skiing, but Rav Shechter and Rav Hulig are famous for saying that's a sakana, right? But I always thought it depended on, which one of the slopes you go on and like how good you are. But that formula I have found over the years to be the most effective, the safest. You keep your patients safe, and it's very legit. So I would say at that triage call, that's what you're doing. You're hearing the person. It eliminates rationalizations that are inappropriate, right? You're also saying, I don't care that it's Shabbos, and that's what gets us into the heter of driving back home, right? And you're thinking, all right, on Tuesday, otitis media, am I rushing to the pediatrician? Am I not? Strep throat, the Chvilei, and all those type of things.
So in other words, we're concerned about the legal status, the nominal risk, so to speak. Is this considered risk or not? If it is considered risk on a Tuesday, therefore you'd be able to do it on
Exactly. And right, exactly. I don't need it to be the majority. I just need that my genuine general sense of reaction to this type of scenario is to treat it as one that's potentially life-threatening, that it generates in me an urgency. Right, and as soon as I've determined that, right, let me give you an example that maybe this will help illustrate what this means. Another example of one that's not an emergency. So somebody will call me from the hospital, let's say, even a cardiac patient, and they have normal rhythm right now, but they discovered that on the EKG they're throwing PVCs or something like that. So there are some contexts, some patients where the PVC is very dangerous and it creates a reaction, and in others where it's just a very benign, normal finding. And could I come up with a scenario where it's something? Yeah, but it's a very far-fetched one. And for the most part, on a Tuesday, I wouldn't be reacting to it. I wouldn't say, oh, I got to see it. I got to, start lidocaine or something like that. But in another scenario, it would be. So you're taking into all the medical information to the best of your ability. And again, if you're not sure, you have to be machmir on the sakanas nefashos and not take a chance.
So sounds like, following that logic, you get the call, you make that decision. In case you think you would need to head to the hospital right now, there's no ifs, ands, or buts. You take your car and you drive. If you think it can wait some sort, you can call an Uber, or you can have what you mentioned, like a prearranged ride. Carrying, we said, you can take a bag, you can possibly put something that's pricey.
Right. If you have the taxi cab driver or the Uber driver available, sometimes it's awkward, but it's still halachically worth it. Let them carry it. Let them carry the thing in and minimize. You're always thinking,
Right.
I know push comes to shove, I can do this. I need to get in. I need to get the stuff in. But always minimize to the best ability. That won't delay things and won't in any way hamper the call.
Right. Okay. So then you get to the hospital. Menachem, do you think we should talk about travel back, or should we?
I think so.
Okay.
I think so. I think while we're on the topic, even though it does go out of order,
Right.
so we kind of explored this a little bit in terms of Hatzalah. Hatzalah, they need to always be at a state of readiness. So therefore, they would be allowed to come back to wherever they would need to be ready to go on to the next call. So that would also kind of mean that you don't want the individuals to avoid taking a call. And so kind of proactively, you allow them to drive back home. And that's, I think, the policy for Hatzalah, definitely in my neighborhood. I think that's well established according to different, I think Ramesh even has a trivia regarding that. So we were kind of struggling to figure out how that relates to the resident doctor. You might know that at the end of Shabbos, you're not going to be on call anymore. How do we model that? Are you allowed to take an Uber home? Are you allowed to, do you have to walk? Can you drive? How do we start thinking about that?
So here, it depends on the scenario. There are several classic scenarios for this. Very important to know this. So, and it might depend on the country you live in, whether it be in Israel or in America, the halacha is actually different. Let me start with the United States. That's most relevant to everybody. I assume that's listening, or most people that are listening, and to you guys. In the United States, people follow either the approach of Moshe Feinstein, which I'll explain in a second, or again, Rav Shlomo Zalman. And there's a third sheet, which is Rav Tzvi Pesach Frank, which is not really followed by too many people. It's the most limited and limiting. Everything comes down to certain Gemara, which I guess we don't have time. I won't go into the whole Gemara itself, but it's a Gemara that seems clearly to favor the approach that I'm going to tell you for Rav Shlomo Zalman, in terms of it, in the simple understanding of the Gemara. But Rav Moshe Feinstein has a very, very creative understanding of this Gemara that ends up saying you could drive home. That's the upshot of it. In terms of our question, if you're called in, let's take the scenario number one. You're on call from home. You're allowed to be home. You don't have to necessarily, there's not a shift tomorrow. There's no shift today. You were able to be home, but you called in for issues. So you have an emergency, a legitimate emergency. You're certainly going to go in. You have a total heter to go in. But once you're done, and you're finished. So what am I supposed to do? So maybe just stay in the hospital. But the heter is that if you didn't have to go in, but you were given this decision to make whether you're going to go in, and it's up to you. You're not being paid to be on a shift, or you're not scheduled for a shift. Then we say, you could go back. That's what I think you mentioned it already, just like Hatzalah. But how do I go back? So the Rav Moshe says you can actually even drive back home. That's the minority view. The majority view for the United States is really Rav Shlomo Zalman and most poskim, which is you can use Amir al-Nachri to go back. It's a big heter, and it's really there just to take Shabbos out of your initial equation, whether I should go in. That's a very important, such an insight of Chazal into human nature. I have to tell you, from my own personal experiences, it is so tempting and so easy to rationalize a triage decision, knowing that you're going to be stuck there. It gets worse. Starting Friday night is the hardest to make the right decision. Shabbos morning, a little better, but still hard. Towards the end of Shabbos, okay, that's the easy one, right? But the rationalizations a person can make, it's like my example with my pericardial effusion. So for sure, in January, you're not going to go in, oh, the fellow, he saw it, you'll make that. You might even do it in July, and then you're crazy. But you get the idea. The idea is to remove that temptation and move that. And we all can be guilty of it. I'm very well-meaning, but I know the thoughts cross my mind, for sure. And people don't understand this, like, how could you think that you're not going to go in? They don't understand what it's like to be on call. They don't understand how, the truth is you shouldn't be taking something that's a 1 in 100 chance you're going to put someone in danger. You shouldn't even take that chance, right? But it's so tempting to do it because 99% he's going to be fine. But really that's wrong. I wouldn't want anyone taking a chance on myself or my family like that. So you shouldn't do that. And yet, very well-meaning people will fall into it because it's very easy. So we remove that and we say, Heter yourself on Mishum Tchilasan, and you can go back again. The psak is really to come back with a taxi or an Uber and doing it Amir L'Nachri. Now, any exceptions to that? Well, if you're called in a lot and you're gonna have to go in, you're gonna need your car. That's like the Hatzalah Heter, and you need your car back at home. So that would be an independent, unrelated Heter to use it, not related to Rav Moshe's Kula from before, but its own Heter. You have to be honest with yourself and talk this over with the postic. I used to get called infrequently in on a Shabbos for those scenarios. So I would just leave my car, take the taxi. And one Shabbos, I ended up with 3 cars. I ended up with 2 of mine and my brother's car, who lives nearby. The biggest challenge is getting the 3 cars back after Shabbos, but usually that doesn't happen. And your scenarios. If you're really mamish called in a lot, an adult cardiologist when they're on call, they could be called in much more than a pediatric cardiologist. Hint, hint. If you're thinking cardiology, don't rule out pediatric cardiology. It has certain advantages. They're more easily going to get the Heter to drive back because there's going to be another MI or another stroke. Although nowadays, who knows? But you can have house step do a lot more than they used to. The next scenario is a shift. You're on Shabbos, but you're off Friday. So the psak in America that was very much the mainstream psak was was to stay in house, like I told you before, was to stay in. But what happens if you're actually on every other weekend and every other Shabbos? You're gonna be away from your family. Now, I remember the first time I was confronted with this. Again, I told you I only had 9 calls my first year, 5 my second. So I had no problem staying in. It was so limited. But I never dealt with anyone because I didn't have to do it myself. Who, they started asking me these shalas. They said, "Oh, I'm on every second, every third." And I'm thinking, "Oh my God, I can't believe it. I don't know if I would have wanted to stay in every other, family." So I referred them to a posek, and I'm not going to say his name. You might be able to figure it out. But this is a shaila to ask, because now the reliance of Rav Shlomo Zalman to this full extent is potentially available. And where if it's going to totally disrupt the person's Shabbos 50% of the time, so again, using Amir L'Nachri, there'll be much more of an allowance for even that scenario. That you go in for your shift, right? Using Rav Shlomo Zalman's initial Heter that I can just go in as needed for the Pikuach Nefesh, and then take even a taxi home. In Eretz Yisrael, this is the norm. In Eretz Yisrael, the whole system would fall apart, is the feeling. Rav Nevinsel writes this somewhere in his Mishnah Berurah interpretations, that, if they said anyone who has a shift, any from Jew who has a shift, cannot go home, it could really wreak havoc on the entire medical system. The norm there is in a place like Shari said, like they have it set. The doctors and nurses get driven home after their shift. In America, it was not like that because the system will go on without us, here in America. So you need a psak. You need to ask this shaila if it comes up. If it's, again, what I would recommend personally, if it's a finite number like what I had, it's kedai to stay in. From a halachic perspective, it's more than it's not even a midas chasidus to me. I paskin that way. I think it's the right thing to do. It's really Rav Moshe Feinstein of the Posek for America, his mainstream approach. But when you're getting into every others and every thirds, even, definitely worth a shaila. Definitely worth a shaila because there's more leeway. under those conditions. Third scenario, the biggie, it's like what I was describing when I was in that house stock, Fridays. Here's where Rav Shechter has a big chumrah. And people, have to realize this. If you're going to paskin, if he's your posek and he paskins for you, he's going to go along with most of the things I've said already. But Friday nights, he says you don't trigger this heter, meaning in order to have the heter of hetiru sofan bishum tchilasan, which means we allow the end because of the beginning. You need the beginning. You need that you went in on Shabbos. But if it's a question of you're there already and you're staying, right, you lose the heter. Now, it's counterintuitive to the logic that I gave you before, right? The logic of the heter is we don't want you making this decision, taking Shabbos into consideration. So if that's true, so Friday should be no different. In fact, Friday happens more often than the Shabbos scenario. To be honest with you, in my experience, I was confronted with this thought process much more on a Friday, because do I leave all the work for my fellow residents? All even if you're in a Shabbos program, I'm telling you that shaila comes up, let alone in a non-Shabbos program. And as a responsible person, fellow resident attending, you want to take care of people first and foremost properly. So this is an important heter to have there, because knowing you're going to be, stuck in the hospital for the entire Shabbos because I'm doing the right thing is a bit of a deterrent from doing the right thing. So it's most poskim do apply it. Rav Shechter doesn't because he learns the sugya that way, but most of the poskim that I've spoken to apply it on Fridays as well as on Shabbos itself. It's a very important thing to know. Any other scenarios for this question?
I mean, I think the biggest thing to elaborate on in terms of relying on Shlomo Zalman's approach is that you kind of have to assume that there's going to be some Jewish patient or potential Jewish patient.
Oh, okay. So yes, now that's a very important discussion. That gets to the heart of something we didn't touch upon, right? When it comes to this sometimes confuses people. There are two levels to the machlokas of Rav Shlomo Zalman and Rav Moshe to be aware of. We've only been really talking about the easy one. The easy one is that we assume, there is a b'nai bris that's going to be taken care of. So, everything we said applies. But if there's not, it brings in a different chelik of the Shulchan Aruch, a different halacha, which is you're not allowed to put yourself b'sakanas nefashos. I don't know if I need to elaborate why
we went in at some length where we tried to look at Reish Memchas. And
right.
hopefully Mark will take this
good.
whole conversation out of the recording.
Okay, good. So once we're there, so it's interesting. It's in the New York area. There's almost always the possibility that a Jew is going to be there. Rav Shlomo Zalman actually, if you take it very in its purest sense, it has to be there. It's not a potential be there. He really writes, and to my understanding, that you need to have actual patient who's present. Others broaden it out a little more. Even Rav
Newbort. Rav Newbort goes further, and the assumption Rav Newbort in Shmei Shabbos Hilchos writes that even if it's a potential patient. Now, the assumption reading his sefer is that he was writing it under the tutelage of Shlomo Zalman Auerbach. I don't know if that's a cynical read. I think
right. Well, it's interesting because I get
Mark's
into this topic.
Kill me at some point.
I will. I'm not to plug myself.
No, this is great.
But I have an extensive discussion of this on YU Torah.
We quoted you extensively throughout, and you're if you look at our I think the thumbnail might even have your face in it, with the link.
Scary thought. But I think that an important issue is, is it a mitzvah, right? One of the sort of dispensations for getting involved in being in a pikuach nefesh situation that you're creating on yourself is if it's the tzorach mitzvah. So is it the tzorach mitzvah if there's no bnei bris there and it's only non-bnei bris? Now I happen to feel that it is, and with good backing in terms of poskim, Rav Aaron Lichtenstein, Rav Nachum Rabinovich, Rav
I don't even think you
Aaron
need to go that
Soloveitchik.
far.
What?
The way the Ramah defines mitzvah by Reish Mem Ches is even going to see a friend.
I
So I
know.
don't.
Exactly. So that's how I feel. But I want you to know that I'm glad I have some allies, it sounds like, in here. But out there, it's not actually the majority shita or the mainstream shita. The mainstream shita is really different, and it's only fair to and correct to point this out. It is not to necessarily go this way, although I'm very comfortable doing it. When people ask me to shayla if they want my psak, that's what it is, because I feel it from the bottom of my heart. It's correct. It's the poskim that I normally, go to are in this camp. But otherwise, it becomes a problem really if you're in the situation where, middle America or wherever it is that there might not be, and people have to be mindful of that. And that's like sort of Rav Shechter puts out a warning, don't take a residency. If it's not going to be Shabbos, but try to make it in a place where, it's shayach. Now, I heard a rumor, or I read somewhere, that Rav Shechter, when he was giving a talk on these issues to nursing school, he mentioned if the initial design of the hospital was as a Jewish hospital, and I have to clarify this with him, I've been meaning to do it, that's enough. In other words, it was, there are a million hospitals like that are initially under the auspices of some Jewish organization or for the purpose of taking care of Jews. No matter what's the current situation, it sounded like somehow, I didn't understand it, to be honest with you, why that works. But if that's true, that opens up a lot of other places that could be potentially amenable to this. So anyone who's in that situation where they're in a particular field where they need to deal with that, they should look into that kind of possibility.
All right. So now going along kind of chronologically. So you get to the hospital, and we established that you have a way back. So that shouldn't color the decision to go to the hospital, which was an important proviso. So you mentioned a little bit before going into electric doors is an issue, and you mentioned that there might be a hierarchy of advisable ways to go through electric doors. What do you do?
Right. So again, if it's an emergency that's very, very bahul, very, very urgent, I just go. I don't think about it. I'll just go right through the door. It means nothing, right? And every step of this way meant nothing. Like if I'm driving in and running in, so that's simple. But if it's not, so within limits, I will wait and stand there and wait till somebody. Nowadays, it's hard to get into any apartment building in New York City. Even this scenario comes up. I've been visiting my children who live on the West Side, Upper West Side, and I keep telling them to move to a building where I can come visit them on Shabbos. But we have a whole discussion of whether it's psik resha, this, that, and the other thing. I said. The only way I'm going into your building is when I wait for somebody to walk in. But so it's a common kind of issue, but I'm weighing it in terms of the timing. So even if I've decided I have a few minutes to spare, and it's hard to do, it's case by case, each medical situation, there'll be a limit, and then I'll have to go in. And it brings me to another one of the things I want to make sure that we talk about, the elevator question on that follows on the heels of this a little bit. The way it works with elevators is, number one, are they the fastest way? That's the first thing you want to know. If you're running to a real emergency, is an elevator faster than me running? So just from a medical perspective, you'll run if you're in good shape, whatever. But that's pashut, that's simple. But if you're running around, like I used to be on call, let's say when I was in Columbia for cardiology. So it's designed much better now. But initially they had like the neonatal ICU was on the 12th floor. The PICU was then on the 6th floor. The call room was on the 2nd floor. Like it was all over the place, right? If I would have been running up and down the stairs all the time, I don't think I would be doing as good patient care. And I'm not just saying that as an excuse. But there was a point where even things that I could have made it in time walking and running upstairs, But I made use of Rav Moshe Feinstein has a very explicit heter on this issue. You have to weigh that as a consideration. It's timing, like I'm talking about, waiting for someone to get me in. And it's also the ability to be, with it, healthy and feeling, alert for a full night of call. It's a real consideration. People are going to think, oh, you're some wimp or something. No, you have to be there and understand what it means to be up all night and have your head clear and do justice to patients, be able to speak. If you're running up 13 flights. I remember I'll tell an aside. One of my children was born on Yom Kippur. So I come in, it's like towards the end of Yom Kippur, and it was, I'm obviously fasting, and my wife, this is before I knew the halachos as well as later. So I thought I had to, the delivery room was on the 13th floor. So I thought I had to ask my wife before I went in the elevator with her, do you need me? By the way, I didn't have to ask her. The halacha really is, women in labor, you just go, right? She says, oh, and I don't think so, not really. So I ended up running up 13 flights. They were putting IVs in me more than my wife by the time I got up there. It was like an incredible scenario. But so that's one thing when you're going just for your child being born. But when you're taking care of other people, you don't want to be standing there getting IVs and, in you. So it's a little bit of an extreme exaggeration, but the idea is good. Rav Moshe knows what he's talking about. He was very well guided in medical reality by Rav Tendler and Rav Yaakov Tendler, who's also is a doctor. And I thought it was a very realistic heter that he gives by that elevator shiloh. Once you're done, you certainly should use the stairs, like in going down, and if there's no other patient to run to, that's the mistake is if you become cavalier about these things and think you could just use an elevator, even with, a Shabbos elevator, and having somebody press buttons for you is a b'diavad that you do if you can't go the other way. So it's not really a lechatchila that people should be doing, even doctors. Unless it involves the types of consequences that I was describing.
So I guess just to elaborate on that. Oh, sorry, Mark.
No, I'm sure we're going to ask the same exact thing. So go for it.
So how do you extend this? So we were talking to one doctor about our last little event, and she's a member of my community in Crown Heights, and she was talking about how she didn't have that much guidance going into residency, and she tried to keep the best version of Shabbos in the hospital on her first Shabbos. And she realized that her sandwiches, the food that she brought, was in the call room, and she'd have to use the electric, key card to get in. So she avoided eating. And she said by the end of that Shabbos, she really, wasn't the type of doctor that she'd want to be. And she said she couldn't do that again. So how do you balance that?
Yeah. So, I'm going to put in a disclaimer before I answer this. I'm going to give my answer and the way I would handle, if she asked me this shiloh. The disclaimer being this is the type of issue you got to talk over with the posek. There's nuance to it, there's subtlety, there's case by case. But I would have told her, if it's true that there's going to be, again, an effect on the way you treat the patient and handle them, particularly if you're dealing with patients that are in sakana, then you have to figure out a way to eat. There's no question about it. The last resort is going to be going into that room, right? Now you're going to do it in, again, the least objectionable way. But you must eat if you need to eat. You can't fast, that's for sure, and be on call. Although you can. Tuesday, I'm sure there's many people that are going to be doing it. But even there, if you think it's going to affect patient care, that's a shiloh. Whether you should be doing it, you shouldn't be. You should not. You cannot let shmiras atanis, do that, and you can't let the key card issue do it also, because you can get it down to a very low level isser, and the compelling need to take proper care of somebody will be a tzarech gadol that by the time you're in the shvus, meaning you can make it to the rabbanons in a way, right? So I'm not saying you can be over under ISIS. You cannot do that probably for this type of hypothetical scenario. But if you're able to do a shinoi on a durabanan, which is what I would be telling her to do in that scenario, that will be okay for this tzarech gadol, which is to be able to treat these people properly. Other alternatives, nowadays, if you're in the right hospital, and most of the New York hospitals have that Shabbos room, that room that, and go get something to eat and don't starve yourself. But I'm saying in the worst case scenario where she couldn't do that, I would have had her do a shvus to shvus, the makom tzarech gadol, to take care of herself and not starve.
But it sort of sounds like if you're in the hospital and you're taking care of patients, you can sort of rely on the fact that you need these things to get done in order to properly take care of patients. And you can rely on the heterim to use the elevator or to get into these rooms. But
right, what I encourage people to do, to be honest, is you have to be careful, because again, there's always the fear of rationalization and overusage of these things. So the best thing to do, what I always tell people is, these are all very reasonable questions to ask your rabbi. Sit with them, go over it. It takes 1 or 2 calls before a resident realizes the scenarios. And if you can't do it ahead of time, which I do recommend strongly, talk to the people ahead of you, find out what goes on and what like you guys are doing, right? And get it down, and then sit with your rabbi, the person they're comfortable with, and get practical, on the ground solutions to these issues, because everything could be worked out. And, again, anything that's not covered, err on the side of doing good by the patient in that sense.
And just to highlight, because this was our conversation Mendel and I had just before you jumped on. So if you are really done taking care of your patients, right, that's going to be your strictest moment right there. So really do everything you can to not rely on any of those things, because no patients are really, we don't imply the same like rationalization that we do with driving home. Whereas if it's going to be extremely difficult to operate, you're going to start to question whether or not you have to go into the first place. We don't.
No, it's interesting. It's tempting to do it, but for the same rationale, but
no.
You need a precedent. You need a real halacha precedent. It doesn't exist. The halacha gives you, in that context of travel, this heter,
okay,
but not otherwise. Not otherwise.
Right. Okay. Great. So, Menachem, we talked about the doors and the elevators. I think we wanted to bring up the concept of key cards. I think you mentioned, in that hypothetical scenario, we talked about the resident trying to get into that room, trying to use a shinoi. We've been trying to rack our brains, like how you could possibly open a door with a key card with a shinoi, and we couldn't seem to solve.
And I think did you use? I don't think for matters of infectious disease control that you should put your mouth on your hospital key card. But that might be my squeamishness. But I think the first thing that you alluded to is that electricity might, again, talk to your posek, might already be a drabanan, which means it is one level of shvus.
Right.
And then potentially the next level of shvus would be some sort of a shinoi. And bear in mind that according to the Rashba, you can do a drabanan straight, even for a chelashem b'sakana.
Right. It's interesting, that heter, which is really, it's made famous by certain achronim. The Balatanya is one of them. I'm just making assumptions. You live in Crown Heights, but that's not necessarily true.
If you can't see the Likutei Sichos and the pantheon of Chabad literature behind me, my name is Menachem Mendel, so that's out of the bag as well.
I thought it was a little obvious, right? So, but anyway, so the Balatanya and the Avnei Nezer, both of them say this. B'di'evid, Shlomo Zalman paskin that b'di'evid we could rely on them for a single durabanan for this type of scenario, but no one other outside of doctors, it's b'shas adchak you can rely on. We are dealing b'shas adchak, so that's what allows us to do it. Most people outside of medicine, never are familiar with that heter and never would use it. That's why, Rabbanim even are shy. Sometimes I give this, I go over these things in YU for the smicha guys, and they're like shocked. I say, it's just for doctors. Take it easy. It's a real shas adchak. Most people in regular life don't have the shas adchak that would justify it. So it's important for people to realize it's not for use outside of the context of a real shas adchak like a doctor. But you're right, you can rely on that under those conditions. You try to avoid it. In terms of electricity, you have to be careful. there, aside from the Chazon Ish, there's famous, the other famous posek who holds that it's daraisa electricity.
Rav Asher Weiss, and
Right.
So we had one of his Talmidim of Hakim off the record who mentioned, and therefore we won't mention that. He mentioned that although that's what he holds, he says that the Malkum Seirech, you can apply the opinions that say that it's the Drabanan.
Oh, okay. Well, that's actually reassuring for many reasons. I once was in his sukkah with like 50 people, a large crowd, and completely forgot his shita about electricity. It was like very embarrassing. So, because I was bringing a whole bunch of shalas from Einstein that they had asked me to deliver it to Rav Asher. So I premised the whole sequence with, oh, and of course electricity is Drabanan. He looks at me like, oh, but it is the majority shita also, just to be clear. Rosh Zalman even is almost at the opposite end of the spectrum on that. He calls it noheg iser. It's like he extensively researches that. So I'm very comfortable with it being Durabanan. In terms of shinuyim, it's interesting, you mentioned the infectious implications of using your mouth, which would have been a good shinui. It's written in Tzitz Eliezer. It's by I forgot who he's quoting, but somebody suggests driving with a shinoi. So I just want to go on record as saying that's lunacy. Don't ever do that. That's a chassid shota legamre. Don't ever even think about it. And you're right. It's very hard with the key card to do it, short of somehow manipulating it with some kind of cover. Maybe you can get like a sterile something. And now you're creating a tremendous shinoi. I don't know if it's doable. But at the end of the day, even using your hand backwards or, like this, which works for writing. This is like a writing shinoi, the chuli alma. It's a literal kala'achayad, right? It could be awkward enough for putting in a key card as well. It's better than nothing. It's like what we say on a computer when it comes to typing on a computer and we want to throw in shinoi there. So there also the shinuyim are quite debatable. Some of them, even the knuckle thing I told you before. But it's, you do the best you can when it comes to these types of shinuyim.
Okay. We have I'm just noting the time, and we have so many questions, and I think what we're doing here is really so valuable. It's so great to get answers to these questions. I'm debating how to go about just continuing on. How much time do you have?
I'm coming to the limits of the time I have right now.
Okay.
What we could do is maybe at a future date set up another session with remaining questions or other questions. Be happy to participate. Does that
Thank you for
work?
that works. That works really well. Thank you so much for indulging us till this point. And I can say it really was an indulgence.
Yeah.
Right. I want to commend you guys. I think you're doing an amazing service. I wish when I was at your stage, I had something like this. It would have been an incredible, and I'm sure it is now, an incredible service for people. Yasher koach, you should be zocheh to many mitzvahs like this. You should be zocheh to have very, very productive careers and do tremendous chesed and become people that are adept at handling all the challenges, which makes the kiyum even greater. And Nishmas Avram is such a beautiful paragraph where he describes, such a challenge to become a doctor, but if you do it right, which means kahalacha, the kiyum is unbelievable. It's like, the story in the Gemara about, I'll end with this, beautiful story in the Gemara about Abaye is upset a little. I think it was Abaye or Rabbi, I forgot which one, upset because Abba Umna, the doctor, gets Baskel every day. He gets Shechina, visits him every day, and he's only getting it once a week. How could it be? So the Amora that he's telling this to, he says, well, you don't have the opportunities, the Kiddush Hashem that Abba Umna does. And it's something. There's a tremendous achrayus in being a doctor, not only in terms of the pragmatic taking care of patients and people's lives are in your hands, But from a Ruchni's perspective, totally from the halachic one, you see more challenges than any other profession in terms of the gamut. And to work hard and to make efforts to do it right, and then to be marbitz it the way you guys are, tremendous kiyum. Yashikol. I'm very, very inspired by you guys.
Thank you.
Thank you so much.